Welcome everyone today. We have some exciting news to share with you. So without further ado, I'm going to introduce Andrew Evans, Board Chair of Hudson Valley Community Services.
Thank you for having me here. What I wanted to talk about is that today, since about 2018, the Hudson Valley Community Services Board conducted a strategic planning. One of the outcomes of that strategic planning was the decision to find a merging partner that would enhance our services and continue our mission. And during that journey, it was hard to find that we reached out to Cornerstone, and we found that there was great synergy between the two organizations. And because of this synergy, we'll improve and broaden the services that we already do by merging with Cornerstone. Merging gives us better assurance that the customer service values and the history and culture of HVCS will be maintained for years to come. Thank you.
Andy, thank you so much. Now I'm going to introduce Wayne Days, Board Chair of Cornerstone Family Healthcare.
Thank you, Andy, and everyone that is attending today. This is a fun day for us. A year and a half ago, 2 years ago, we assisted Middletown Community Health Center in their endeavors to find a partner to merge and continue to provide services in the western part of Orange County. And today we have an opportunity to unite with HVCS on the, Orange County, but five or six other counties, and continue to help promote their services, pairing with us. So for us, it's a fantastic day. The decision to merge our organizations came after many months of due diligence on the part of both boards. Numerous meetings, numerous staff meetings, all the employees broke into teams. It was a very well organized and coordinated process. And when we got into it, it made a lot of sense to us. Our ability to provide medical services to their patients, their ability to provide services to our patients, it just seemed to mesh nice for us. So all of our board of directors are committed to making this work for us. We are very excited about it, and we believe that by using both organizations, we'll improve all of the services to everybody and continue to provide the top-notch service that we've provided in the past, and we'll look forward to continuing for the next 50 years. Thank you.
Thank you, Wayne. Next, we're going to call up Mike Oates, President of the Hudson Valley Economic Development Corporation.
It's great when organizations come together and they have strategic plans and they actually execute on them. It doesn't happen often, and it's certainly great to hear. This is obviously wonderful news for the Hudson Valley, and very, very happy to see two outstanding organizations coming together to provide better healthcare solutions to the region. As the management of both organizations start to work together, I'm confident that they'll find both cost savings, they'll find best practices, and they'll find better ways to compete in the marketplace. And I think that's what we want to see in our healthcare sector and in all of our sectors throughout the region. These are very smart people behind me. There's very smart people on the boards, and I think they're going to come together and really bring some exciting things together as this fully comes together. I want to single out Linda for a moment. Linda's on our board of directors, and she's really committed to finding, not only to think about what happens on a day-to-day, but to think long-term and think into the future, where healthcare should be and how we can best provide solutions to employees and people throughout the region. So I appreciate all her work on our board, and I'm excited to offer our assistance as an organization as the merger comes together. If there's any ways that we can be helpful, we certainly want to be able to do that. So again, this is phenomenal news for the region, and I couldn't be happier for both organizations. Thank you.
And now I have the pleasure to introduce Andy Strauss, Executive Director of Hudson Valley Community Service. We've gotten to know one another a lot over the past few days, so I couldn't be happier to be introducing her. Thank you.
So it is with great excitement and anticipation that we announce the planned merger of Hudson Valley Community Services and Cornerstone Family Healthcare. The HVCS HVCS board, directors, and staff undertook a comprehensive strategic planning process, which you just heard about 2 years ago, in which it was decided that to ensure the continuation of HVCS's mission and services in a changing healthcare environment, the ideal path forward would be to find a partner with similar mission and values with whom to align ourselves. We found that partner at Cornerstone, an organization 30 years. Together, our two organizations as an integrated entity will be able to continue offering not only the quality medical care that Cornerstone has always delivered under its outstanding leadership, but also brings HVCS's expertise to address the social determinants of health that are so critical in ensuring that the Hudson Valley residents have a high quality of life. I'm so pleased to see HVCS enter a new phase in its development and growth and to be here today. Thank you very much.
Andy Evans on Hudson Valley Community Services side. Their wonderful work with their boards and getting them to just fully understand the impact that this could make, and then bringing the unity of both boards to have this happen is truly remarkable. And I thank you for your leadership, and I thank you for your dedication. So thank you both. To my partner, Andy Strauss and I have known each other for 20 years, in a very different role, but one that continues to flourish even today. Her commitment to her organization, to her people, and to her clients is what makes this work. That same passion that she has is reflected every day in our health center. So the question you may be saying is, why do this? We do this because New York State is moving from the traditional way of paying for services from volume to value. And what does that mean? It means that there comes a point in time where there needs to be integrated delivery systems that come together and form either, whether you want to look at the axis as being horizontal or vertical, a place where patients and clients have multiple points of access, where the patient is really worked in the best places that work for them, that the costs are contained, and all these things will happen as we start this new partnership. As we develop our systems, we will improve performance, we will increase efficiencies, we will have new access points, and we will be a truly patient-centric service provider that will have abilities to provide settings that make the most sense for our patients and for our clients. Cornerstone Family Healthcare and Hudson Valley Community Services has many years of working together. We have strong referral agreements between our organizations. With this merger, we will strengthen a single point of entry. We will take the social determinants of health that they're provided so beautifully through those services of Hudson Valley Community Services and merge them with the medical side of our house, providing a comprehensive single point of entry where all patients will be treated with respect, with dignity, in a place where they feel comfortable, and the services are appropriate to where they are when they need it most. So I could not be any more proud to say that we will be working and embracing the staff that is Hudson Valley Community Services, have them work with us as we singularly do the thing that we need to do most. Ensure that everyone has access to the services that they need, when they need it, where they need it, in a cost-effective manner that produces the best outcomes on behalf of all of our patients and clients. Thank you for being here, and I can't wait to look forward to the future. Thank you so much.
Just one last thank you. I'd like to single out Jay Dewey, who helmed the communication effort on the Hudson Valley Community Services side. We couldn't have done it without this teamwork in letting both our staff know and now the rest of the community. So thank you. So we can either, for the media that's here, we can take some questions, or we can do some both sides. So, but this concludes our press conference. Thank you.